my name is Erica. I'm a nurse practitioner student at UTEP, and today I'll be doing a comprehensive head-to-toe assessment on Nathania here. And always prior to seeing any patient, make sure your hands are washed. Mine are. So we're going to first start with her mental status. So I'll be asking her a few questions, like what's her name?
Nathania.
And where are we right now?
On the west side of El Paso.
Yes, we are. And can you tell me your date of birth?
12/16/92.
Do you know what day of the week it is right now?
Wednesday.
Yes, it is Wednesday. So just from answering those questions, we know that she is alert and oriented times 4. Because of the questions that I asked, we were also able to look at her language function, fluency, comprehension. She's talking to me normally. There's no issues there. We're next going to test her memory. So by doing that, we can ask her questions like, what did you do this weekend?
Well, today's Wednesday.
Mhm.
I worked on Friday, Saturday, and then I have Sunday off.
Okay, awesome. And so that's good for short-term memory. Next, we can ask about long-term memory. So, what did you do for Christmas last year?
I went to Phoenix Suns game.
Oh, nice. Sweet. We love basketball. So again, those are just questions. We know that her short and long-term memory are intact. The next thing that we are going to test is calculation. So it's just going to ask her to count down by 5s. No, we'll do 10s from 100 to 0. Go ahead.
190, 80, 70, 60, 50, 40, 30, 20, and 10. And
Perfect.
0.
Yes, awesome. So we see that she can do that kind of math in her head. The next thing we're doing is visuospatial processing, and that's where we're going to ask her to draw something that most individuals should know how to draw. So I'm going to grab a pen and a paper, and if you could draw me a house, any kind of house. Perfect. I don't know if you can see it, but yes, it's a house that has a chimney that even has smoke in it. Wonderful. Thank you so much. The last thing we're going to talk about for mental status is her abstract reasoning, the ability to do that. So if, for example, an intruder came in, what would you do?
Well, it's an apartment, so there's only one way out. Well, actually, I would probably jump out the patio and grab my dog first.
Always
And call 911.
Perfect. Yes. So we know that your abstract reasoning is intact. So next, we're moving on to the head and neck portion of the exam. So we'll be looking at her face, we're looking at her skin, we're looking at her hair, her scalp, the shape of her head, the skull, and we'll see if there's any kind of abnormalities. So first, we're looking for symmetry in the face. We see it's symmetrical. There's no kind of droop. Skin looks clean. She doesn't look any kinds of dirty. We can look at the hair. She has normal distribution. It's clean as well. There's no lice. There's no lesions. She has nice distribution throughout her entire head. Do you feel any pain or tenderness when you do that? Okay. Her head's normal cephalic. There's no pain or tenderness on palpation. We can feel the skull has a normal contour. There's no deformities, no impressions, no bumps or tenderness. So head and neck or head, face, look. Because we are still on the face, we're going to test cranial nerve 7 first. And this is just going to, I'm just going to ask you a few questions and we'll see if that cranial nerve is working, okay? So go ahead and raise your eyebrows for me. Perfect. And then close your eyes as tight as you can. Okay, go ahead and smile. Frown. You can open your eyes if you want to. And then this one's a little weird. So just fill your cheeks with air. Perfect. Okay, so cranial nerve 7 is intact. Next, we're going to test the sensation of the face. So this is through the trigeminal nerve or cranial nerve 5. So what I'm going to do is, we're going to do it 2 different ways, okay? So I'm going to get a cotton pad and I'm going to touch your face, and then we're also going to clench your teeth, and I'm going to just feel the muscles in your face, okay? So go ahead and clench first. We'll do that. Okay, I'm just going to feel. And then go ahead and open your jaw. Okay, perfect. And then I have a contact, and that's where we're going to test your sensation, okay? So just for reference, this is what it feels like, okay? We're gonna do this, if you lift your glasses up for me really quick. We're gonna do this on both sides, all right? So can you feel this? How about here? Can you feel that? You can't feel it? No, I know, I was just
Oh.
testing you. Go ahead and keep your eyes closed. Can you feel this? This?
Yes.
How about here?
Yes.
And on this side?
Yes.
Okay, and did all of that feel the same?
Yes.
Okay, so we know that the trigeminal nerve 5 is intact and working the way that it's supposed to. Next, we're gonna palpate the cervical lymph nodes. We're gonna look at size, shape, mobility, and the consistency of the lymph nodes, okay? So first we'll start here at the top, right in front of the ears. So this is the pre-auricle ones. We can go to the back of the ear, the posterior auricle, and again, not feeling anything at all. We can go to the back of the head. This is where our occipital lymph nodes are. We're gonna go up here to the tonsillar, and again, can't feel anything. Here we have tonsillar as well. Here we have the submandibular and the submental, and again, nothing's palpable at this point. We have the superficial cervical. We'll do one side at a time. And here on this side, again, not feeling anything. Down here, we have our deep cervical chain. Again, nothing is palpable at all. And then we do have our posterior cervical here in the back, again on this side. And then lastly, the supraclavicular. And no lymph nodes were palpable at all. Okay, so next we're moving down to the neck. So we're gonna look at the trachea, we're gonna look at the thyroid gland, and then we're also gonna we're listening for the carotids to see if there's a groove present. So we're gonna look at the trachea first. So we're gonna examine just based off inspection. Her trachea does not look deviated at all, but now we're gonna feel for that deviation, okay? So I'm just gonna touch your neck, down, here, on the other side. And based off palpation, it is not deviated whatsoever, it's not swollen. So now I'm gonna listen to the breath sounds over it with the diaphragm and the stethoscope. So just breathe normally for me, okay? Okay. And yeah, breast sounds are present. There's no evidence of stridor whatsoever. Next, we're going to examine the thyroid gland. So I'm going to come from behind you. That's right below the cricoid cartilage, about right here. I'm going to feel. Can you actually tilt your head back slightly for me? Okay. And yeah, there's no goiter present. No kind of swelling or anything like that. I'm actually also going to listen to the carotids, like I said. I'm going to do this one at a time, okay? And that's with the bell of the stethoscope. So this side over here, okay? Go ahead. Okay, listen. Okay, and yeah, there's no breathe. So next we're moving on to the eyes. And this is where we're going to test cranial nerve 2. So we're going to do a visual field test, like the wiggle test, to help look at her peripheral vision. So what I want you to do is you're going to cover one eye, and I'm going to come from the back. So you just keep your eyes on me, and you tell me when you can see my fingers moving, okay? So, but look at me. Look at me. You see him here?
Mm-hmm.
Okay, so now let's change the other eye. So cover this one. Keep your eyes on me. Let me know when you see him. Keep looking at me. Right at me.
Yes.
Okay, so we can see that her cranial nerve 2 is intact. Now we're just going to take a look at the eyes, their position, their alignment. We're going to see if there's any kind of protrusion or deviation. So just go ahead and take a look at me. You have the glasses off. Her eyes are symmetrical. There's no deviation, no protrusion whatsoever. We're also going to look at the eyebrows as well as the eyelids and the eyelashes. So for eyebrows, they're again symmetrical. She has hair. There's no hair loss there. No kinds of scales or anything like that. In terms of the eyelids and the eyelashes, she has beautiful long lashes. The eyelids are pink in color. There's no pallor or anything of that nature. And when her eyelids are closed, there's no lesions, ulcers, or anything like that. So next we're going to look at the lacrimal apparatus, the conjunctiva, the sclera, and then we're also going to be looking at the iris, the lens, and the cornea all at the same time. So what I'm going to do is, again, ask you to take glasses off, sorry, just so I can see your eyes better. but we're gonna pull down on your eyelids. That'll let us look at the lacrimal apparatus, the conjunctiva, and the sclera. Okay, so you're just gonna feel me pull. So conjunctiva is pink, sclera is white. She doesn't have any dryness or excessive tearing in the lacrimal apparatus. There's no swelling there either. So now we're gonna look at the cornea, iris, and the lens. So we're gonna use a pen light, shine from the side, see what we can see. Okay. Okay. So we do see that the markings of the iris are clear and defined. The cornea and the lens are free of opacities, and there's no kind of bulging from this kind of. All right, so next on our eyes, we're gonna test cranial nerve 2 and 3. So just pupillary reaction to light. So I'm gonna shine this light in your eyes. You just keep looking straight ahead, okay? Here we go. Ready? It's brighter, right? If I can put it on. Okay, perfect. So yeah, her pupils are equal, reactive to light. They do accommodate, and they're about a size 3 or 4, give or take. Next, we're going to test for convergence. So I'm just going to take my finger, and you're just going to look straight at it. I'm going to come right at you, okay? And then just follow it. Ready? Perfect. Yeah. So she also, her eyes do converge. We're going to test cranial nerve 3, 4, and 6. So it's just your extraocular eye movements, okay? So just follow my finger. We're going in a few different directions, okay? So we'll start here, and then we'll just follow the finger. Okay, perfect. Yeah, so her eye movements are symmetrical. There's no nystagmus, and she doesn't have any weakness in her ophthalmoscope. We are going to look at the optic disc, the cup, the retina, and the retinal vessels. So I'm gonna turn this on. If you take your glasses off, you can. Sorry. And then with my right eye and using my right eye, I'm gonna look at your right eye and then do that on the left side. Okay? So I'm gonna come in, and then you could lift up, your eyelid for me. Let me see if I can get closer to you. Okay. Okay, let me do the other side. Okay, so there's no bulging in the disc. It's sharp, and it's kind of like an orangey yellowy color. And there's no visible lesions on the retina at all. And there are some arteries and veins that are visible there. Moving on to the ears, first we're going to assess your hearing. It's going to be cranial nerve 8, okay? So I'm just going to come stand behind you. You'll cover the left side and just repeat the letters or numbers that I say to you, okay? All right, go ahead and cover that ear.
4, D, 8.
Okay, we'll switch. Perfect.
8, 7, W.
Perfect. Okay, so now we're gonna determine if you have any hearing loss or not with a Rhine and a Weber test. Okay, so we're gonna use this tuning fork, and I'm gonna hit it. We're gonna place this on the mastoid bone. When you can't feel the vibration anymore, let me know, and then we're gonna move it to the front of the ear and tell me when you can stop hearing it. Okay. So here we go. All right, I'm gonna move your hair just a little bit back, and again, this is cranial nerve 8. So. Okay.
I felt it and I can hear it.
Okay, so we'll do the other side. Yeah. All right, here we go.
Okay. And I can hear it.
Okay, sounds good. All right, so we know that cranial nerve 8 is intact, okay? And now we're gonna move on to the palpation of the ears. So I'm just gonna go ahead and feel your ears, see if there's any lumps, tell me if there's any tenderness. We're gonna assess for color, lesions, everything like that, okay? So I'll do both at the same time. Feel okay? All right, yeah, there's no lumps, no lesions, their ears are clean, both sides. Okay, last part of the ears, we're gonna use an otoscope and we're going to examine the ear canals, take a look at the tympanic membranes, we're gonna look for cerumen, we're gonna see if what those tympanic membranes look like, and go from there, okay? So I'm gonna pull back on your ear a little bit and take a look. Yeah, so we can see this tympanic membrane, it's pearly gray in color, there's no redness, there's no excessive cerumen or anything like that. We'll go to the other side, do the same thing. Again, I'm just gonna pull on your ear, stick this in. Yep, and so we see again that tympanic membrane. This one's also pearly white, there's no redness. We can actually see the cone of light here at 7 o'clock too. So yeah, the inside of her ears, there's no redness, no swelling, no lesions of any sort, or perforation. First, we're going to test the sense of smell. That's cranial nerve 1. So you're gonna close your eyes and tell me what you smell, okay? Go ahead.
Oh, that's strong.
What is it?
Vanilla.
Yes, it is pure vanilla extract. So we can see that cranial nerve 1 is intact. Now we're going to look, we're just gonna inspect the nose and we're looking for symmetry, deformities, any kind of tenderness. So I'm also gonna use the pen light to look not only at the top of your nose, but we'll look inside as well, okay? So just from inspecting, we can see that the nose is symmetrical, there's no deviation, at least from the front. So I'm gonna you go ahead and look up for me. You can go ahead, look inside. Again, no deviation, pull up just a little bit, sorry. Okay, and we see that the nasal mucosa is pink, it's not dry, again, there's no deviation, no polyps, there's no ulcers or anything like that. We can also use the otoscope too to get a better look. I won't do that to you, stick that in your nose as well. But that'll also help us to see if there's any kind of nasal deviation, ulcers, even like polyps deeper into the nose. Lastly, I am going to palpate the maxillary and the frontal sinuses. You just tell me if you feel any tenderness, anything, okay? Good, how about here? Okay, wonderful. So, no tenderness. All right, so now we're gonna move on to the mouth and the pharynx. Initially, we're just kind of inspecting. We're looking at the lips, we're gonna look at their color. There we go. They're pink, they're moist, there's no cracks, there's no ulcers, there's no lesions. Next, we're gonna inspect the oral mucosa. So this is done with a tongue blade and a pen light, okay? So I'm gonna sit down your tongue, take a look at the oral mucosa. We're also gonna take a look at the gingiva, the gum margins. We're gonna take a look at the teeth. And then we'll take a look at your hard palate and your soft palate too, okay? So go ahead and open wide. Okay, sorry. So based on our assessment, we can see that the inside of her mouth, the oral mucosa, again, it's pink as well. It's moist, there's no lesions, there's no ulcers. Again, the gums are pink, the gum margins are normal. The mouth is free of swelling. Her teeth are white, they're straight, they're not dirty. And she has good on the roof or the hard palate of the mouth, as well as the floor of the mouth. There was no discoloration, nodules, there was no deformities like that. And now we're going to look at cranial nerve 12. Cranial nerve 12. This is going to be the tongue. We're looking for color, we're looking at the texture, we're looking at deviation, atrophy, and we're just going to see, we're going to make sure that that cranial nerve is intact. So can you go ahead and just stick your tongue out with me? Okay, can you point it up? Down? Side to side? Okay, perfect. And then if you could open your mouth and just say ah. Can you go ahead? Okay, stop. One more time. Okay, perfect. So cranial nerve 12 is intact. Her tongue was able to do the movements that I asked. And then for the cranial nerve 10, we saw that the uvula went up when she stuck her tongue out, or when she said ah. There are again no lesions noted. The back of the mouth is pink, it's moist, there's no lesions. She does not actually have tonsils, so we didn't see those, but the pharynx is free of lesions and any kind of. Going to, I guess, reassess cranial nerve 9 and 10. So we're just gonna ask the patient to swallow for us. This is sponsored by Dr. Pepper. Perfect. So no issues with swallowing. Also, cranial nerves 5, 7, 9, 10, and 12 do help us with our speech. We don't need to test that because she's been talking this entire time. We know that she can articulate and that her speech is clear. She doesn't have any hoarseness or issues with speech itself. So we're good with those. Now we're going to move on to the neuro portion of the comprehensive assessment. So we're going to look at involuntary movement, muscle tone, and muscle bulk. So from what we can see, that the patient doesn't have any kind of involuntary movement. There's no fasciculations, no kinds of tremors whatsoever. And we were also able to see that when she walked in. So I'm just gonna take your arm and do some passive movement. You just kind of let me play with your arm. And we can see, even just feeling the muscle bulk and muscle tone, there's no kind of atrophy or anything like that. She does maintain a little bit of tension when moving, but that's completely normal with this kind of passage range of motion. Her muscle tone, muscle strength seems to be fantastic. Cranial nerve 11. So what I'm asking you to do is just shrug your shoulders for me, and then go ahead and do it again. Okay, yes. So cranial nerve 11 is intact. So now we're going to be moving on to muscle shoulder abduction first. Okay, so what you're going to do is you're just going to raise your arm to the shoulder level, and I'm going to push down on both your arms. Okay, so go ahead and abduct for me. So up. Okay. So yeah, she does have great muscle strength. She's out of 5. The next one we're going to do is elbow flexion and extension as well. So what I'm going to have you do is just keep your arms like this for me. I'm going to put my wrists or my hands on your wrist, and I just want you to push and pull against me. So I'm going to push, okay, and pull against. Okay, perfect. So yeah, elbow extension and flexion are both rated out of 5. So next we're doing wrist flexion and extension. This is spinal root innervation C6, C7, and C8. Okay. So what I'm going to have you do is you're just going to put your hands, I guess, in a fist. And then I want you to come up and come down, okay? So I'm going to push against you, all right? And then go down, push against, okay? So her muscle strength there is at a 5. Strength we're going to do is finger extension and abduction. So what I'm going to have you do is put both your hands like this, and then I want you to just try and bring your fingers to the ceiling, okay? So go ahead, and then we're going to go down as well, okay? And again, that muscle strength is at a 5. The next thing we're going to do is thumb abduction, or actually we're doing finger abduction too. So just put your hands both like this for me, and I just want you to try and keep them spread apart while I push. Okay. Okay, good. So muscle strength is at a 5. Next, we're going to do thumb abduction. So I want you to keep your hands like this, and I want you to try to keep them pointed towards the sky. I'm going to push down towards the palm. Okay. Come up. Again, muscle strength is out of 5. So now we're going to move on to hip flexion. So what I'm going to have you do is, our patient's laying supine. I'm going to put my palms on your thighs, and I just want you to try and lift your legs up, okay? So go ahead. Okay, next one. Perfect. Again, normal muscle strength. Knee muscle strength. We're going to do flexion and extension, okay? So patients sitting supine, go ahead and put your knees or your heels too, just like that. Perfect. So I just want you to try and straighten your leg for me. Okay, do it on the other side. And then go ahead and try to keep, I'm gonna pull and you pull too. Okay, ready? Perfect. Okay, so yeah, again, muscle strength. So we're gonna look at dorsiflexion. So this is just for the ankles, as well as plantar flexion. So I just want you to push and pull against me with your feet, okay? So go ahead and push. Go ahead and pull. Okay, again, same thing, muscle tone is So now we're going to assess coordination, and this is done through rapid alternating movements. So the first one, just want you to mimic what I'm doing, okay? You're gonna be flat, and you're just gonna, perfect, as fast as you can. We can see that her movements are symmetrical, they're smooth, she's not having any issues with this at all. The next one is gonna be rapid finger tapping. So we're just gonna, we can do just one, we can do multiple. Again, no issues with these movements whatsoever. point-to-point movements. So this is we're gonna do finger to nose. We're also gonna do heel to shin, okay? So what I want you to do is touch my finger. So my index finger with your index finger to your nose, okay? So go ahead, touch your nose to my finger, okay? And we're just gonna keep going. Just want you to follow me. Perfect. Okay. Awesome. Perfect. Good job. So again, her movements were smooth, symmetrical, no issues there. Next, we're gonna do heel to shin. So what I want you to do is take your heel, bless you.
Sorry.
No, it's okay. Take your heel, bring it up to your shin or your knee, and they're gonna run down your shin. And do that on the other side as well. And again, these movements come with complete ease. Lastly, we are going to look at her gait. So what you're gonna do for me, we're gonna do multiple things, okay? So I want you to do a casual walk that way. We're gonna look at her balance to see if that's intact or not. Go ahead. We see that she does have good balance. Her arms are swinging, her legs are moving symmetrically, turns are smooth. Okay, we're gonna stop there. And you're gonna walk again, but this time I want you to walk on your tiptoes. And then when you come back, on your heels. And again, we're looking at plantar flexion. You can see she has dorsiflexion as well that way. Her ankles are intact. Again, she still has good balance despite her funny walks, but neurologically she's intact that way. Lastly, we're gonna do a heel to toe walk. This is a tandem test. Again, we're looking at balance, we're looking at symmetry, and all those things. And again, she has that. There's no issues with her gait. Point-to-point movements. So this is we're gonna do finger to nose. We're also gonna do heel to shin, okay? So what I want you to do is touch my finger. So my index finger with your index finger to your nose, okay? So go ahead, touch your nose to my finger, okay? And we're just gonna keep going. Just want you to follow me. Perfect. Okay. Awesome. Perfect. Good job. So again, her movements were smooth, symmetrical, no issues there. Next, we're gonna do heel to shin. So what I want you to do is take your heel, bless you.
Sorry.
No, it's okay. Take your heel, bring it up to your shin or your knee, and they're gonna run down your shin. And do that on the other side as well. And again, these movements come with complete ease. Lastly, we are going to look at her gait. So what you're gonna do for me, we're gonna do multiple things, okay? So I want you to do a casual walk that way. We're gonna look at her balance to see if that's intact or not. Go ahead. We see that she does have good balance. Her arms are swinging, her legs are moving symmetrically, turns are smooth. Okay, we're gonna stop there. And you're gonna walk again, but this time I want you to walk on your tiptoes. And then when you come back, on your heels. And again, we're looking at plantar flexion. You can see she has dorsiflexion as well that way. Her ankles are intact. Again, she still has good balance despite her funny walks, but neurologically she's intact that way. Lastly, we're gonna do a heel to toe walk. This is a tandem test. Again, we're looking at balance, we're looking at symmetry, and all those things. And again, she has that. There's no issues with her gait. What we do is test your position sense. So what I want you to do is we're gonna stand, you're gonna just stand here for a few seconds, close your eyes, and just be. Okay? This is called a Romberg test. This is gonna help us see if she can have an upright posture for X amount of time. Usually it's 30 seconds. There's no swaying. Minimal swaying is normal, but she doesn't have any. So we're good there, okay? The next thing we're gonna test is the sensory system. We're gonna do this with light touch, pain, temperature. We're also gonna look at proprioception. We're gonna look at vibration and discriminative. What we're doing is light touch. So I'm gonna touch different parts of your body. We'll touch your face, arms, legs. You just tell me when you can feel it, okay? And then let me know if they do feel the same on both sides, okay? And I may trick you and not touch you at all, all right? Just so you have a heads up, all right? Go ahead.
Yes. Yes.
Are those the same? Okay, what about here?
Yes.
Okay, here?
Yes.
What about on that side?
Not touching. Yes.
Maybe the same? Here?
Yes.
And this one?
Yes.
Okay, wonderful. So we're good in terms of light touch. Next, we're gonna move on to pain. So we have some tweezers. They have a sharp end and a dull end. So for reference, this is dull, this is sharp, okay? So we're gonna do the exact same thing. So I'm gonna start on your face, okay? You tell me what this one is.
Sure.
How about here?
Sure.
And here?
Dull.
This one?
Dull.
Do they feel the same?
Yes.
Okay. This side?
Sure.
Over here?
Sure.
Here?
Dull.
This one?
Dull.
How about here?
Sure. That was dull.
And this one?
No.
And this.
Sure.
Okay, and do they feel the same on both sides? Perfect. Okay, so your conception of pain is good as well. Next, we're gonna move on to temperature. So you just tell me if this is hot or cold, okay? Cold. Okay, and does it feel the same on this side? Okay, perfect. So your temperature is good. Next, we're gonna do proprioception. This is basically just grabbing the patient's fingers and toes and letting them tell us if they can feel them going up or down, okay? So show me both of your hands. Close your eyes, and then you just tell me if we're going up or down.
Up. Down. Up. Up.
Okay? Let me see your toes.
Up. Down. Up. Up. Down.
Okay, perfect. So yeah, that is intact as well. Next, we're gonna move to vibration. So again, we're gonna use this tuning fork, and I want you to tell me when you can feel the vibration in the joints of your hands and in your toes. Okay? So go ahead and give me one of these. Can you feel it? Okay. How about on this side?
Yes.
Okay. And in your toes.
Yes.
How about here?
Yes.
Okay, perfect. So sense of vibration is intact as well. Last, we're going to move on to discriminative sensations, which is stereognosis, and this is going to be her ability to tell us what's in her hands within 5 seconds of feeling it. Okay, so go ahead and give me your right hand and tell me what I put inside of it.
That's a coin.
Yes, love this.
Pen.
Okay, last one.
That's a key.
Perfect. Now bring me your left hand. Tell me what this is.
That's a pen.
Okay, this one.
That's a key.
Yes, and lastly.
That's a coin.
Awesome. Okay, so this is also a part of the neuro assessment. We're going to look at reflexes. So we have a reflex hammer here. So first we're going to try to elicit a bicep reflex, and hopefully see the contraction of the bicep muscle. So we're going to go ahead and grab this arm. You would do this bilaterally. We're just going to do one side, and let's see if we can see it. We were able to elicit that reflex. So next we're going to move on to the tricep, and see if we can do this one as well, okay? So we're going to bring your arm out this way. We're going to hit about right here. Okay, sweet. All right, so we were able to do that one as well. Next, we're going to move on to the brachioradialis. That's going to be this one here. It's going to be about 2 to 4 inches above the wrist, all right? So go ahead and hit right here. That hurt a little bit? I'm sorry. Okay, there it was, a little bit there. Okay, next we're going to do the patellar, and then we'll move on to the Achilles tendon, okay? So we're going to go ahead, stand right here. Perfect. And then we're going to do back here. Okay, cool. So we were able to elicit all the. So now we're going to move on to the cardiovascular and the respiratory part of the assessment. So when you're assessing this part or these two systems, it is better to have the shirt off so that the bell and diaphragm of the stethoscope can hear the lungs and the heart better. But for the sake of this video, we'll keep your shirt on, okay? So first we're gonna look at the respirations. We're gonna look at the rate, the rhythm, the depth, if she's any distress, and just based off inspection, we see that her respiratory rate is regular. She doesn't look like she's in any acute distress, especially in terms of her breathing, maybe a little bit tired, but not in any kind of distress whatsoever. So now we're going to inspect, percuss, and palpate both the front and the back of the chest. While doing this, we're going to look for deformities, any kind of muscle retraction, any kind of lag that she may have. We'll see if she has any bruising. We'll see if she has any lumps and bumps, and any kind of, and we're going to look at her respiratory expansion as well, okay? So we're going to test respiratory expansion or see if that is symmetrical from the front. So I'm just going to feel you here. Go ahead and take a breath with me. Perfect. We're going to do the back as well. Go ahead, take a breath. Yes, so anteriorly and posteriorly, we do have symmetrical respiratory expansion. And was that hurt at all when I touched you? No. Okay, so no tenderness on palpation as well. So next we're going to percuss the anterior. Percussion is next. This is done with our fingers by tapping on different parts of the chest. We're gonna do 12 different spots in the front and 14 on the back, okay? And we should hear just normal resonance on percussion, all right? So you just go ahead and sit up straight with me. I'm gonna start here at the top, okay? All right, other side. Okay, so now we're gonna go to the back. Again, this is 14 different spots, okay? Again, the top. And again, yes, we did hear resonance all over. Next, we're gonna do fremitus, and this is gonna be by hearing you say 99. Now we're gonna test for fremitus and vocal resonance. So I'm just gonna place the lower aspect of my hand on your chest, and every time I move it, you can just say 99, okay? So we're gonna go ahead.
99. 99. 99.
We do the other side. We're gonna do the back as well too, okay?
99. 99. 99.
Okay. And here's the back. Go ahead.
99. 99. 99. 99.
One more side. Go ahead.
99. 99. 99. 99.
Okay. So yeah, we were able to hear that or feel that vocal resonance. Okay. So now we're going to listen to the lungs with a stethoscope. We're going to use the diaphragm this time. We're just listening for breath sounds. We're listening for any adventitious sounds. And we're going to do both the front and the back of the chest, okay? So I just want you to breathe normally for a minute. Okay, go ahead. Okay, I'm gonna come down here a little bit. Yeah, sorry. Go ahead. Okay. Okay, so now we're going to the back. Go ahead. Okay, last one. Okay, so she has clear breath sounds all over, no adventitious sounds. Listening to breath sounds, now we're going to listen to transmitted voice sounds. So we'll listen to the same spots, and you're just going to say 99 for me, okay? Go ahead.
99. 99. 99. 99. 99. 99.
Sorry.
99.
Mm-hmm.
99.
Okay.
99.
Mm-hmm.
99.
Mm-hmm.
99. 99. 99. 99.
Okay, so move on to the back. All right, go ahead.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, so So yeah, those transmitted voice sounds are muffled. The cardiovascular assessment. And first we're going to inspect the front of the chest. Again, this would usually be done with the shirt off. We take a pen light, we'll take a look at the apex of the heart, but for the sake of this video, we're gonna keep her shirt on. So next we would palpate the precordium or any heaves, thrills, and see if we can palpate any heart sounds. So I'm gonna use the palm of my hand as well as my fingers as well to see if I can feel any of these heart sounds, okay? So we'll start with the tips. All right, I'm gonna move on to my palm. I wasn't able to feel any thrills, any heaves, or any pop-up. We're going to try and palpate and locate the point of maximal impulse or the apical pulse. So my patient is already laying in the left lateral decubitus position. I'm going to go ahead and try and feel the apex of the heart, midclavicular line between the fifth and fourth intercostal space. Okay, so you're just going to feel me come under here. See if I can feel it. Okay. Yeah, we can actually feel it. So, yeah, you can feel that her apex right there at the bottom. And now we're just going to listen to S1 and S2 from the different positions, the 6 different positions of the heart. Okay. So if you go ahead, oh yeah, I guess I can keep you laying down. That's okay. Okay, and yeah, so she does have S1 and S2 present. There's no muffled heart sounds, there's no murmurs or any other extra sounds. That should be there. The abdominal portion of the assessment. So of course, first we're gonna inspect the surface. We're gonna look at movements of the abdomen. We're gonna look at her skin temperature, see if there's any scars, any striae. So just based on our inspection, we can see that the skin is smooth, she's pink in color. She's warm in temperature, there's no scars, there's no striae or anything like that. Next, of course, we're also going to, we have to listen first because we don't wanna palpate and cause any kind of abnormal sounds to be heard. So we're gonna listen with the diaphragm of our stethoscope, and then afterwards, we'll, with the bell of our stethoscope, listen for any bruits, okay? So we're gonna start in the right lower quadrant, right? So normally, oh, hold on. Let's assess that bruit too. Okay, so there's no bruit present. When you're listening for abdominal sounds, you do want to listen for 30 seconds in each quadrant. We only did 5, and within those 5, I did hear about 5 or 6 clicks per quadrant, which is neuroactive for her. Percussing and palpation, we're also going to see if we can elicit abdominal reflex while we're here. So we're going to make an X towards the umbilicus on her abdomen, okay? See if we can elicit any kind of response. Did it tickle? A little bit. I want to say yes, but I'm not 100% sure. This is a hard reflex to elicit, but it does look like a smidge. So next we're going to percuss. Again, using fingers, okay? So we'll start in the lower right quadrant, right? And so with percussion, we do hear those normal sounds of timpani and dullness. Now we're gonna palpate lightly, so that's just gonna be with the fingers, and then afterwards we'll palpate deeply with 2 hands, okay? So we're gonna start again, right lower quadrant, so this is just light palpation. And with light palpation, there's no masses. I can't feel any lumps like that. Does that hurt at all? No? Okay, so now we're gonna move on to deep palpation. Does it hurt when I do that? How about on this side? Nothing? Okay. When palpating the abdomen, we do want to check for signs of peritonitis. This would be guarding, rigidity, rebound tenderness, but during palpation, the patient stated that she wasn't in any kind of pain, so there are no signs of peritonitis. Okay, so now we're gonna we're gonna measure the liver. So we're gonna do this by starting at on the right midclavicular line. We're gonna go past the umbilicus just to make sure we do hear the dullness on the liver so that we don't miss it. And then we'll come back up probably about the nipple line and come down to see if we can get that measurement, okay? We'll do that here and here, all right? So you're just gonna feel me tap you a little bit, okay? We're gonna start down here at the bottom. Feels dull here. Okay, let's start up here real quick. Midclavicular, so, sorry. Okay, we come down here. Okay, it feels dull there. Okay. That's give or take 7 to 8 centimeters. So you do have a normal liver span on percussion. Next, we're gonna move on to palpating that liver edge. What I want you to do is just to take a deep breath. This is gonna help the diaphragm push that liver out, okay? So you feel where your ribs are. Okay, go ahead and take a deep breath for me. Okay, yeah. And that the liver is palpable about 3 centimeters below that right costal. So next we're gonna palpate the spleen, and we're gonna do this along the drop space, which is here. So we're gonna percuss at the 6th intercostal space on the anterior axillary line down the left costal margin, which again, that's called the drop space. So I'm gonna just come across and I'm gonna do this percussion thing on you, okay? So on percussion, the spleen does have tympani. So now we're going to palpate the splenic edge with the patient supine like this, and then we'll ask her to turn on to the right side to see if we can palpate the spleen that way. So I'm going to reach over, kind of bring you up a little bit, and palpate into your that quadrant up here, okay? Just going to feel me. Sorry, I don't want to pull your hair. Sorry, am I hurting you? Okay. All right. And I can't feel the spleen this way, so I want you to go ahead and turn onto your right side for me. This is hopefully going to allow gravity to pull that spleen down. And again, we're going to do that exact same thing, okay? And the splenic edge is barely palpable. But somewhat. I'm gonna ask the patient to sit up for me. We're gonna check the kidneys. So what we're gonna do is just called CVA tendus, which is the costovertebral angle. So we're just gonna hit the back of, well, the lower back and see if there's any tenderness upon when you feel that hit, okay? Anything? No? Okay, all right. So that's going to be the end of our abdominal assessment. Now we're going to move on to musculoskeletal, okay? Look at the shoulders, the shoulder girdle. We're going to look at the front. We're going to look at the back. We're going to look at the scapula and any of the related muscles posteriorly. So just from the front, we can see the patient's shoulders are symmetric. There's no deformities. There's no lumps. Does it hurt at all? No. Okay. And then we're feeling the scapula as well. There's no swelling, there's no muscle atrophy. The scapulas are equal and symmetric as well and positioned normally. So now we're going to assess her range of motion of the shoulders. That's going to be with flexion, extension, abduction, and adduction. So what I want you to do is with both arms, because we always do this bilaterally, we're going to take our arms forward and just lift them up all the way to the sky, all the way back down and back towards the seat or the back wall.
Mm-hmm.
Perfect. So that's flexion and extension. She has full range of motion. Now we're going to do abduction and adduction. So abduction, you're going to put your hands at your sides and bring them up. That's abduction. Perfect. We're going to go back down. Adduction. So she does have that full range of motion there. Next, we're going to do internal and external rotation of the shoulders. So external, you're going to take your shoulder or your arm like this, come up, go back down. Perfect. And then we're going to go backwards. And then we would do that with the other arm as well. Go ahead. Perfect. Internal. Sweet. So now we do have full range of motion there. Next, we're moving on to the elbows. We're going to look at the contours of the elbows. We're going to tell you what the external surfaces feel like on both sides. We feel the ulnar on here as well as the epicondyles on this side. Again, same thing. There's no nodules. There's no swelling. No kind of abnormalities there. Next, for range of motion, we're going to look at flexion, extension, as well as pronation and supination. So for flexion and extension, you can just bring your arms up this way and out. That's going to be extension. Flexion, you bring them back in. For pronation, so just bring your arms forward this way. So they're already pronated, so we're going to turn them upwards. Then supination and back pronation. Perfect. So she does have that range of motion of the elbows to the hands and the wrists. So wrists primarily first. So we're going to take a look at your hands. See what they look like. Go ahead and just kind of move for me. Perfect. Okay. So just based on inspection, we see that the patient does have smooth, natural movements of the hands as well as her fingers. She's got the normal positioning. There's no swelling, no deformities. There's no angulation either. And there's no any kind of thickening contractions of the tendons within the fingers and wrists. So we're going to move on to the range of motion for the wrists. So it's going to be flexion, extension, abduction, and adduction. So we're just going to put our palms forward like this. We're going to go up towards the ceiling. That's flexion. Extension, we're going to go down both ways. And then for adduction, we're going to go inward and then outward for abduction. And we see that she does have the range of motion. Full range of motion. Now we're moving on to the range of motion for the fingers. So we're going to do flexion, extension, abduction, and adduction as well, okay? So for flexion and extension, we're going to keep our hands forward. I just want you to move the fingers. Actually, we're not going to do that. We're going to bring them into a fist. So that's going to be flexion. Bringing them outward is going to be extension. And then for adduction, you're going to bring the fingers in. Abduction is going to be away. Spread them out. Perfect. So she has full range of motion for the fingers. Next, we're going to move on to the range of motion for the thumb. So we're going to have our palms out with this. You're going to bring your thumb to that pinky. So that'll be flexion. Bring it back out. It's going to be extension. Go ahead. And then for abduction and adduction, again, our hands are going to go like this. You just bring that thumb up. That's going to be abduction. Adduction, you bring it right back. Okay. So yeah, so we have that full range of motion in the fingers and in the thumbs. Part of the range of motion that I forgot for the thumbs is to do opposition. So that's just bringing your fingertips together. Yep, just like that. Okay. So yes, she does have that full opposition, flexion, extension, range of motion for the thumbs. Next, we're moving on to the spine. So first, when we are inspecting a patient's spine, we're looking at their posture. We're looking at the cervical, thoracic, and lumbar portions of the spine and those curves. We're going to do that laterally from the back and from the side. We're also going to look at the spinal column, the alignment of the shoulders, and we're looking at the iliac crest. So if we stand behind the patient, we can see that she does have normal posture. We can look at her from the side as well. The curves of the spine are normal. The iliac crests back here are symmetrical as well. We can also look at the gluteal folds of the patient, but for the sake of this video, we'll keep your clothes on. She does have a smooth and coordinated neck movement, which also we were able to see when she walked as well. So now we're going to move on to the range of motion for the neck, so the cervical portion of the spine. So for flexion, what I want you to do is look down for me. You're going to put that chin to chest. Then to do extension, we're going to bring the head all the way back, looking up towards the ceiling. We'll do rotation, so you're just kind of twisting your head from side to side, and then we're going to do lateral bending. So that's just ear to shoulder. Perfect. Just like that. Okay, so now we're going to move on to the thoracolumboSacral range of motion, so that part of the spine. Again, we're doing flexion, extension, we're doing rotation and lateral bending. So for flexion, you're just going to touch your toes. Go ahead and bend all the way down for me. Perfect. And then for extension, you're going to go all the way back, but I'm going to support you so far back as you can. Wonderful. Perfect. So great range of motion there. For lateral bending, excuse me, you're going to just go side to side. Just like that. Like you're touching the sides of your knees. And then for rotation, you're just kind of twisting at that middle back, that hip. Just like that. So yeah, that part of the spine, the thoracolumboSacral, does have great. Now for the hips is what we're going to do in terms of inspection, range of motion. Again, we do this when the patient is walking. We've already assessed her gait, but for the sake of this portion of the video, we'll have you walk again. We're looking at her stance, we're looking at her swing, we're looking at the base width, the pelvis shift. We see which is normal, symmetrical. There's no issues with her gait and the way that she walks. When she lays down for her range of motion, we'll also look at her leg symmetry. But again, she does have a normal hip, normal gait, which helps us with her hip inspection. Okay, so now for our range of motion, we're going to have you lay down, and we're going to be on our back first. Okay. So we're going to start with flexion. So I just want you to bring your knees to your chest for me, okay? Perfect, just like that. Awesome, and then we'll take these bad boys off real quick, and we're gonna do abduction and adduction of the hips. So what I want you to do is just kind of like you're making a snow angel. Yep, just like that. So abduction is gonna be out, adduction is gonna be in. We see that she has range of motion for both sides. And then we're going to do internal and external rotation. So again, you're going to bring your knees up, flexed, perfect. We're going to go inward, so that's going to be internal rotation, outward, external rotation. And we'll do that again bilaterally. Beautiful. Awesome. So now I just need you to get prone for me. So get on your belly for me. We're going to do extension. So what I want you to do is bend your knees. We can do both, or we'll do one at a time. So go ahead and just bring that knee up. Perfect. Other side. Awesome, just like that. So we do have full range of motion in looking at the knees. We did look at the knees when she was walking. We did see that knee flexion as well. When she walked, we also want to look at the alignment, the contour, and the different hollows within the knees. We see that these little contours, the hollows, those are completely normal. There's no swelling, there's no deformities, no kind of muscle atrophy here. So now we're going to inspect her range of motion. So what I want you to do is to just make your legs as straight as possible, one at a time. And then when you bring that leg back down, that's our flexion. So extension out, flexion back in, other side, perfect, just like that. So range of motion again here is normal. This portion of our musculoskeletal exam is going to be our ankles and our patient's feet. So again, we're going to inspect for the surfaces, just the complete surfaces of the ankles and feet. We're looking for swelling, nodules, deformities. We're looking for calluses. We're looking for corns. Upon inspection, she doesn't have any of those. There's no swelling whatsoever. You actually have like really little feet. What size shoe do you wear?
6.
Okay, yeah. So you have nice little feet. Like I said, there's no deformities, no swelling, there's no nodules, no corns or calluses like that. So now we're going to move on to the range of motion for the ankles. So what we're going to do is plantar flexion and dorsiflexion. So what I want you to do is just put your toes for me and then bring them right back up. So that range of motion is great as well. Next, we're gonna do inversion and eversion. So inversion, yep, you're gonna bring your feet in. Eversion, bring them out. More like this. And in that way. Your ankles like don't move at all. There you go, like that. And then outwards. Perfect. Yeah. So she does have that range of motion there. And that completes our head to toe assessment. Thank you so much for being my patient. Thank you for watching.